Illinois has new mask mandates effective immediately, but there's already some pushback. Amanda Vinicky joins us now with the latest. Amanda, what are the new requirements?
Well, Paris, Illinois is not requiring universal masking again, though the Centers for Disease Control and Prevention does recommend that everyone don a face mask in public settings where there is significant chance of spread of the COVID virus, and that does include in Cook County and the surrounding collar counties. But Governor J.B. Pritzker today announcing 3 new targeted mandates. First, effective immediately, masks are required in schools, both public and private. That's for students, for teachers, for staff, regardless of vaccination status. And that's from preschool through high school. Pritzker says too few school districts chose to follow CDC masking guidance.
Given the CDC's strong recommendation, I had hoped that a state mask requirement in schools wouldn't be necessary, but it is. The Delta variant is highly transmissible, more so than any other previous forms of this virus.
That does mean that student athletes and their coaches will have to wear masks when they're practicing or playing games, when they're inside, but outside where there's lower risk of transmission, the governor says no masks will be necessary for those student athletes. Pritzker says that enforcement of the mask mandate will be schools' responsibility. As he says, it's their job to keep children safe, and Illinois has potential recourse if they don't.
This is something that's endeavoring to. Schools can be held liable if they don't follow the mandates that are put in place. There's even the ability for the state to revoke recognition status for a school, though I think that's something that would happen long after other mitigation or other efforts are made to get a school to impose mitigations.
Pritzker's action drew immediate rebuke from Republicans who have long been critical of the governor for, they say, going it alone, taking unilateral action instead of involving the legislature to combat the COVID virus. Now, the 3 Republicans who have declared bids to run against Pritzker in next year's election, they were more vociferous in their opposition to what he did. Gary Rabine says that it is not about control, it's about control, not science. And then you have Paul Schimpf saying that Pritzker's actions are inconsistent with the civil liberties that he defended as a Marine. Then you have State Senator Darren Bailey, who called it a power grab by Pritzker and framed masking as a matter of freedom.
We cannot sit back and let one person who has never stepped foot in most school districts across our state pretend that he knows best for your children and our schools. Parents, teachers, and elected school board members should be making these decisions at a local level.
Bailey also tried to question the science, saying that children aren't getting super sick and that schools are not the source of COVID outbreaks. But Director of Public Health, Dr. Ngozi Ezike, says the science does show that, especially with this more transmissible Delta variant. She says that the percentage of those younger than the age of 20 who were hospitalized with COVID tripled from 2.5% in January to 7.8% in July.
While most children who get COVID have fewer symptoms than adults, they absolutely can still get COVID-19. And they can absolutely spread it to others. We have clearly witnessed that spread this summer throughout Illinois. Numerous cases of COVID-19 have been linked to youth camps.
Now, moving on to that second mandate that the governor has implemented, it requires masks to be universally worn in long-term care settings like privately run nursing homes. Long-term care facilities have been hotbeds for outbreaks throughout the pandemic. And then this third action, state employees who work in congregate settings must get the coronavirus vaccine. That includes state-run veterans homes, developmental centers, and prisons. Workers have until October 4th to get vaccinated.
Many of the long-term care facilities employees have themselves not been vaccinated. They run the risk of carrying the virus into work with them. And then it's the residents who are ending up seriously sick, hospitalized, or worse. It's a breach of safety. It's fundamentally wrong. And in Illinois, it's going to stop.
According to state agencies, 53% of staff at Department of Human Services, developmental centers, and psychiatric hospitals are vaccinated. Percent of correctional officers and staff at Illinois prisons. And then at Illinois Run Veterans Home, the percentage of vaccinated staff is 64%. The director of the state's largest public employees union, AFSCME, says these employees bravely worked throughout the pandemic and says in most cases, the vaccination rates are higher than in the communities in which those state facilities are located. We strongly oppose any effort to define these employees as part of the problem rather than recognizing their dedication and the vitally important contributions they have made to protecting health and saving lives, AFSCME's director Roberta Lynch said in a statement this afternoon. Now look for the governor, normally allied with unions, and the AFSCME to have to negotiate over this. So far, the governor has not issued an executive order that spells out these mandates, but his office does say that one is coming. And while the governor called these initial steps, he says there is no plan right now for any sort of shutdown or even a universal mask mandate for masks to have to be worn inside and other public places. He says, unlike when Illinois previously took those steps, he says things are different right now. And that is because we have the option of getting the vaccine, which he encourages everyone to do. Paris, with that, back to you.
All right, a lot of new regulations. Amanda, thank you very much.